Hi everyone, this is Dr. K. I wanted to talk about some new models in healthcare recently. When COVID-19 first came through, there was a big push for telemedicine. Most of the private insurance plans, as well as Medicare, would decline paying for telemedicine in the past, unless the doctor is 50 miles outside the location where the patient is, and so forth. They had like these rules. But starting COVID-19, they removed all those rules because they realized patients cannot get out of the house and all of those reasons. So telemedicine has become more popular since then. So we are waiting to see if the insurance plans will roll back and remove these requirements to pay for telemedicine in the next few months. That would be an interesting development. But no matter what the insurance plans are doing, people in general have started embracing telemedicine, and they have been pursuing other cash-based programs where they have access to the physician on a 24-hour basis in case they have to talk to someone. And they feel that that's a very important aspect in the care. Obviously, you can call your regular doctor. Most of the times, you may get a call back at the end of the day or by the next day, and that is conventional medicine. And that's and the reasoning behind that is like if there is a true emergency, you would go to the emergency room. But these days, people are afraid to go to the emergency room because they're not sure if there's COVID-19 patients sitting there in the waiting room, and they would rather talk to the physician on the phone or via Skype or video, in case they have a concern. So, and there are true life-threatening emergencies. If you have a heart attack or stroke or something that needs to be addressed right away, you still have to go to the emergency room and take the risk. But most of the people, don't have those. They may have mild illnesses that they want to be able to talk to a doctor. So telemedicine is going to grow significantly over the next months to years. And there's a growing shift towards having a physician, like a concierge doctor, to be available like a 24-hour basis, where you can text them, you can call them, or you can email them. So this is going to be a trend that we expect to grow over the next few years, because a lot more patients and clients want this type of service. There are services for OBGYN where this is available. There are services for primary care, and there are companies that are offer this for pediatrics, where if your kid has an ear infection, you can talk to the doctor right away on video and get a prescription right away. So, in the past, we used telemedicine for minor things like ear infection or throat infection, something that's like really slight illness or really minor illness. But lately, what we see happening is telemedicine is going to be used for even routine care, like your 6-month visit where you need refills for your blood pressure medications or diabetes medications. Chances are, this will happen via telemedicine. And we also noticed that telemedicine, will go into specialty care. So if you need a consultation with a regular GI specialist or a cardiologist or a pulmonary, you have to wait anywhere from 3 to 6 months, through your regular insurance plans. Those are very restricted on whom you can see. So for people in general, they want more instant gratification. They want to address the questions sooner than later. So in those situations, you'll see more services where the specialty doctor will be available via telemedicine, same day or the next day, if you need a consultation or if you need a quick follow-up visit. So I see this particular trend growing, and this is really exciting. This is forcing a lot of doctors to change what they're doing. It is forcing me to change what I'm doing. It is forcing me to give more options to my private clients. Hi, Linda. So this is really exciting. It is a challenging time for all of us, but it's also very exciting. We're having to invest a lot of money and resources into technology platforms that are going to help us deliver this type of care. and hopefully we'll have more patient-friendly technologies that can help this accomplish. Right now, most of the telemedicine platforms, you have to download an app on the phone or on the computer, and you have to log in, and then you can initiate the conversation with the doctor or the nurse practitioner. Going forward in the future, we'll probably shoot a link to the phone, to the smartphone, and they should be able to click on the link, and they should be able to launch either a browser or an app where they can start having a video conversation with the doctor or the provider. So that's where this is going. I'm very much interested in these things. It's going to be a challenge going through the technology phase, but I think it's a good change for all of us. We don't see like 30 patients sitting in the waiting room, and all of them are waiting to see 3 to 4 doctors in a regular day. We don't see that happening anymore in the next 1 to 2 years. We may see 1 or 2 people wait in the waiting area and at a time. So it's a really exciting time. If you're interested in finding concierge vision, I can refer you to some who are in your insurance plan. You can always DM me. There are a lot of good resources in the community. And as I said, I always communicate with my private clients, on a regular basis, via email, text, and everything, via phone. So I believe in instant gratification. That's the new trend. So I always believe in getting back to the clients as soon as I can. So no matter what happens with the COVID, whether it goes down and it never comes back again, or whether it surges back again in the fall or next year, no matter what happens with this, the telemedicine is here to stay, and probably you'll see more concierge doctors coming into practice. So look forward to talking to you all again. Have a good night. Okay, bye.